Imagine your liver working silently, 20/47, filtering toxins, regulating metabolism, storing energy, and supporting nearly every function in your body, all without you ever thinking about it. Now imagine that, slowly, unnoticed, it begins to suffer damage. You feel fine. Maybe a little fatigue here or there, but nothing alarming. Yet inside, the damage is accumulating. This is what happens with silent liver damage. Unlike a heart attack or stroke, which announce themselves loudly, liver damage often creeps in quietly. Many people don't realize something is wrong until the condition is advanced. Fatigue, bloating, or digestive discomfort may be dismissed as stress or lifestyle, while the liver struggles behind the scenes. One of the most common causes is fatty liver disease, where fat accumulates in liver cells. It's linked to obesity, high sugar intake, processed foods, and sedentary lifestyle. Non-alcoholic fatty liver disease, or NAFLD, affects millions worldwide, often without obvious symptoms. Over time, it can progress to inflammation, scarring, or even cirrhosis if not addressed. But diet isn't the only culprit. Everyday habits, like consuming alcohol regularly, even in moderate amounts, can strain the liver. Many people believe small amounts are harmless, but chronic, low-level exposure can trigger inflammation and impair the liver's detoxifying capacity. Medications are another hidden factor. Common over-the-counter drugs like acetaminophen, when used frequently or at high doses, can overwhelm the liver. Even seemingly harmless supplements or herbal remedies can interact with liver enzymes and cause stress if taken excessively. Environmental toxins, chemicals in cleaning products, personal care items, and even pollution can add to the liver's workload. Your liver processes and neutralizes these compounds, but continual exposure makes it work over time. Blood sugar and insulin also play a role. High intake of refined sugars and carbohydrates leads to insulin resistance, which is strongly associated with fatty liver disease. When liver cells store excess fat, they trigger a cascade of inflammation, oxidative stress, and cellular damage. Despite all these hidden risks, your liver has remarkable resilience. It can regenerate and repair itself if you recognize the problem early and make supportive lifestyle changes. The challenge is knowing the warning signs before the damage becomes serious. Early indicators are subtle, persistent fatigue, unexplained bloating, mild right-sided abdominal discomfort, dark urine, pale stools, or even itchy skin. Often, these signs are brushed off as temporary or unrelated, but they may signal the liver is struggling to keep up. Genetics and age can influence susceptibility too. Some people have genes that make them more prone to fat accumulation or alcohol-related damage. Others may maintain liver health longer with a clean lifestyle, but the habits you practice daily, diet, activity, sleep, and stress play a huge role in tipping the balance toward health or harm. Now let's explore the everyday habits that quietly harm your liver, often without you realizing it. Some may feel harmless, even normal, but over months and years they add up. First, let's talk about diet. Highly processed foods, sugary drinks, refined carbs, and fried snacks are major contributors to fatty liver. These foods overload your liver with sugar and unhealthy fats. Excess sugar is converted into fat in the liver, a process called lipogenesis, which leads to fat accumulation and inflammation. Even if you're not overweight, these dietary habits can silently damage your liver. Alcohol is another big factor. Many people think that a glass of wine or a couple of beers a day is safe, while moderate alcohol can be acceptable for some. Chronic consumption, even in small amounts, increases liver stress. The liver must metabolize alcohol into less toxic substances, and repeated exposure triggers inflammation and fat deposition. Over years, this can progress to alcoholic fatty liver disease, fibrosis, or cirrhosis. Next, medication misuse. Painkillers, cold medicines, and even some herbal supplements are processed by the liver. Frequent or high-dose use of acetaminophen, NSAIDs, or certain antibiotics can overwhelm liver enzymes. Many people don't realize that combining multiple medications, even over the counter, can multiply the liver's workload. Sedentary lifestyle also silently impacts liver health. Lack of physical activity reduces insulin sensitivity, encourages fat storage in liver cells, and increases inflammation. Even 20-30 minutes of daily movement, like brisk walking or light resistance exercises, can significantly improve liver fat metabolism. Another overlooked factor is chronic stress and poor sleep. Stress hormones, like cortisol, influence glucose metabolism and fat storage, indirectly affecting liver function. Inadequate sleep disrupts hormone balance and increases oxidative stress in the liver, making it harder for the organ to repair itself. Environmental exposure plays a role too. Everyday contact with chemicals in cleaning products, pesticides, and even some personal care items adds to the liver's detoxification workload. While a single exposure is harmless, repeated, low-level exposure forces the liver to work harder over time. Hydration matters as well. Water helps the liver flush out toxins efficiently. Chronic dehydration makes this process less effective, slowing detoxification and contributing to fat accumulation and inflammation. Even seemingly harmless habits like excessive energy drinks, caffeinated beverages, or sugary smoothies can increase oxidative stress and fat deposition in the liver. While caffeine in moderation may have protective effects, high sugar intake undermines this benefit. Finally, ignoring subtle symptoms is itself a risky habit. Fatigue, abdominal bloating, mild digestive discomfort, or unexplained itching may seem minor, but they can indicate early liver stress. Regular checkups, liver function tests, and awareness of family history are crucial for early detection. Now let's focus on what you can do to protect your liver and reverse early damage, even if it has been silently stressed for years. The good news is that the liver is remarkably resilient. It can regenerate and repair itself when given the right support. First and foremost is dietary adjustment. Prioritize whole, unprocessed foods, fresh vegetables, fruits, lean proteins, whole grains, and healthy fats like olive oil, nuts, and avocado. These foods reduce inflammation, improve insulin sensitivity, and help the liver metabolize fat efficiently. Avoid excessive sugar, refined carbs, fried foods, and ultra-processed snacks that overload your liver. Hydration is essential. Water supports the liver in flushing toxins and aids metabolism. Aim for at least 2-3 liters daily, depending on your activity and climate. Herbal teas like dandelion milk thistle or green tea may also provide antioxidant support to liver cells. Next, exercise. Regular physical activity improves fat metabolism, reduces insulin resistance, and lowers inflammation, all crucial for liver health. Even 30 minutes of walking, cycling, or light strength training daily can make a measurable difference. Moderate alcohol consumption or avoiding it altogether is another key step. If alcohol has been part of your routine, reducing intake allows your liver to recover and prevents long-term fibrosis. Even a few months of abstinence can significantly improve liver function in many cases. Medication awareness is vital. Take only what's necessary, follow recommended doses, and consult your healthcare provider about safer alternatives if you need frequent pain relief. Avoid combining multiple medications without guidance and be cautious with herbal supplements. Stress management and sleep also directly affect liver health. Chronic stress raises cortisol, which can increase fat deposition in the liver. Mindfulness, meditation, deep breathing, and adequate sleep help balance hormones and reduce oxidative stress on liver cells. Monitoring your health is important. Regular liver function tests and routine checkups help detect early signs of liver stress or damage. Early intervention, sometimes as simple as dietary changes or lifestyle adjustments, can prevent serious complications. Other supportive habits include limiting exposure to environmental toxins, such as harsh cleaning chemicals or pesticides, and maintaining a healthy weight. Even modest weight loss in overweight individuals can significantly reduce liver fat and inflammation. Some people may benefit from supplements like milk thistle or vitamin E, but these should only be taken after consulting a healthcare professional. There is no single magic pill for liver health. The key is consistent, sustainable lifestyle choices. Ultimately, protecting your liver is about awareness, prevention, and early action. Your liver silently works for you every day, filtering, detoxifying, storing nutrients, and supporting metabolism. By adopting healthy habits now, you give it the best chance to continue performing these vital functions efficiently, reducing the risk of long-term damage like cirrhosis or liver failure. Simple daily choices, a clean diet, hydration, movement, rest, and careful medication use can have a profound impact. Even if your liver has been quietly stressed, it can heal. The sooner you start, the better. Your liver is one of the hardest working organs in your body, quietly filtering toxins, regulating metabolism, storing energy, and supporting almost every system without asking for recognition. Yet many of us unknowingly place it under constant stress through everyday habits. From sugary drinks and processed foods to alcohol, medications, and even chronic stress. The silent nature of liver damage is what makes it so dangerous. Early symptoms, fatigue, bloating, mild abdominal discomfort, or changes in stool or urine are often dismissed, giving the liver more time to struggle quietly. By the time major symptoms appear, serious damage may already be underway. The empowering truth is that the liver can regenerate and heal if given the right support through balanced nutrition, regular exercise, hydration, limiting alcohol, mindful medication use, stress management, and routine medical checkups. You can protect your liver and even reverse early damage. It all comes down to awareness and consistent action. Every healthy meal, every glass of water, every moment of rest, and every informed choice helps your liver recover and continue working for you. Your liver may work silently, but the care you give it today will have a lasting impact on your overall health, energy, and longevity. Protect it, respect it, and give it the support it deserves, because a healthy liver means a healthier, stronger you.